the MS Michigan Man 64 podcast. My name is Brian Wallace, and I am the MS Michigan Man 64. The MS Michigan Man 64 podcast is about chronic disease awareness. I have had multiple sclerosis for the last 27 years. It's an invisible chronic disease that I've been battling for half of my life. I want to share with you what it is like living with the chronic disease from my experiences and the experiences of other chronic disease warriors. We can fight to have a voice to those that want to listen. Together, we can motivate and educate. Hi, and welcome to the MS Michigan Man 64 podcast. Today, I am sitting down with Jan. Jan is from South Shields, England, and Jan was diagnosed with Pheochromocytoma, which is a tumor that grows in the adrenal glands that is just, it's a crazy disease that I really don't have any knowledge of. And I met Jan through social media, and Jan reached out to me, and we started talking, and we created a friendship. And she asked if she can come on and talk about this disease. And I said, yeah, absolutely, because if I don't understand it, then I think a lot of people are in the same boat as me. So I appreciate anybody that wants to come and talk about their chronic disease that they were diagnosed with, just so that people understand it a little bit better. So I'd like to welcome Jan. How are you doing today, Jan?
I'm doing good, thank you.
Yeah, thank you for coming on, Jan. I really appreciate you. So you, can you kind of take us through, first of all, kind of explain the diagnosis that you received? And I apologize for not saying that word. It's just, I have a hard time pronouncing it. It's just, and that's what the thing that's kind of like really intrigues me about hearing this is because I don't think a lot of people even know what this disease is. But go ahead and give us your version of what you went through with this diagnosis.
I think you did very good pronouncing that. It's called Pheochromocytoma.
Thank you.
It's a rare tumor that grows in the adrenal glands. And it was diagnosed in 2023. Because I lost a lot of weight and started having really bad tremors and anxiety and stuff like that. Before that, I just put it down to depression.
Mm-hmm.
But anyway, when I lost the weight in England, they send you on the cancer pathway because they thought it was cancer. Well, it is cancer, but not that kind of cancer. It grows very, very slowly and it kills you in another way, not with the cancer.
Mm-hmm.
But it was odd how it was diagnosed because I hadn't heard of this before. They didn't really tell me what it was. They told me it was a lesion in the adrenal gland.
Mm-hmm.
They did some blood tests, and they wanted more blood tests, and then they wanted more blood tests.
Yeah.
Then they decided to send me to see a surgeon who did a CT scan, which verified it had grown.
Yeah.
And I said, well, how do you know? And he says, well, we've seen this in 2017 when you had a scan for your bowel.
Mm-hmm.
And I says, well, how come did you not see anything? And he says, well, as long as it's not secreting, we just leave it alone.
Yeah.
Well, I'm sorry, but my attitude is it's cancer. It should be
taken out,
removed, or at least let me know that it's there.
Right. So what kind of symptoms were you experiencing? Because I know that when we've talked, you said that you've been dealing with this, the symptoms of this for 30 years. It's been getting misdiagnosed. They've been telling you it's fibromyalgia. So just kind of explain the path that you took to even get to that diagnosis in 2023, because you've been dealing with this for so long.
That's true, yes. Well, in my 30s, they just said it was depression, anxiety. They even checked my thyroid gland because it started to look like I had an underactive thyroid.
Mm-hmm.
Because it presents itself like cushions. You put weight on, it's uncontrollable weight gain. And of course, thyroid does that too when you've got an underactive thyroid.
Mm-hmm.
But what happens is it can secrete and then stop secreting, and then you just have a normal life and then have bouts of it.
Yeah.
So because they'd done the tests and they said everything was fine, you just accept. You know, that it's depression. You've just got to take the pills and get on with it.
Yeah, so they're treating you for other things that aren't even really the tumor. They're treating you for depression. And they even diagnosed you with fibromyalgia, right?
Yes, that was in 2017 because I started having more symptoms. I was getting internal tremors, which I didn't even go to the doctor and mention because they kept making out I was crazy.
Yeah, they're blaming.
You know, it's all in your mind.
It's all in your head. Yeah.
And then the physical shake started, and of course they just kept giving me antidepressants.
Yeah.
But the scan in 2017 was just a regular bowel scan that they do here in England. Just when you get to that certain age, they'll do a bowel scan to make sure you don't have bowel cancer. And that was when they spotted it, apparently. But they didn't see anything. They didn't tell me. They didn't tell my doctor.
Yeah.
And then in 2023, I started having huge weight loss. I lost about 2 stone in 6 weeks.
Wow.
I would wake up at night and be having these huge adrenaline surges, and I thought, oh, this is another Pheochromocytoma. No, sorry, another fibromyalgia symptom. So I just ignored it. Right. I just ignored it and just got on with life. But when, with the weight loss, I went to the doctors and she sent me on a cancer pathway, which means that you get seen to quicker.
Yeah. So,
of course, they do the checks on the female, you know, check you haven't got cancer in your womb or ovaries or anything like that. And it's a scan. And here they saw the lesion again in the adrenal gland. But had got bigger. Excuse me, I'm going to have to cough.
You're fine. You're fine.
And that was when I got a phone call from an endocrinologist, and I didn't know why nobody told me. They still hadn't told my doctor.
Yeah. Wow.
Which is crazy.
Yeah, that is crazy.
And
go ahead.
It was crazy.
Yeah.
Sorry, go on.
No, I just had to ask, like, you know, you struggle to get this diagnosis, and the mental drain on you just has to be unbelievable for going for so long with like being misdiagnosed, being treated for symptoms that weren't even related to the tumor, and I just couldn't even imagine the mental health part of it.
Well, I just know that I feel like I've had a traumatic life because of my mental health.
Yeah.
Because since finding out what this is and doing more research on it, it can make you do things that aren't in character.
Yeah.
If that's the correct way to put it.
Yeah. Like, can you elaborate on like some of the symptoms that you know, it made you it changed the way that you were thinking?
Yes, it did. It makes you impulsive and do things that you wouldn't normally do. Like, I just decided one day that I'd had enough, and it wasn't that same day. Obviously, I had to save money up and organise passports and stuff, and then just made a friend in America and moved there. Lived there 9 years.
And it was just like on a whim, and you think that was because of the tumor that you were dealing with that was being untreated. It made you do things that were just impulsive, that probably were out of the norm for you.
Now I do, now that I know what it is and how it affects the reasoning and thinking. Yeah.
Wow.
Now I do. At the time I didn't. I just thought, I'm just going on an adventure.
Yeah, you're just living life, and but you really don't even understand. You know, you don't have doctors that are giving you answers. You're just plugging through life. I get it, and I know that you had said that when you came to the United States, and I want you to talk about this story too, because this is just amazing, just the difference in healthcare. When you said you came over to Seattle, Washington area, and it was there in the United States that they actually found breast cancer on you, and it was like missed in England.
It was definitely missed in England. I mean, one of the things they say is if you have any leakage from the nipple, that it's cancer.
Yeah.
And of course, I went in and told the doctor that I had breast milk, and he said, "Oh, well, you know, you get wet nurses at your age, so I wouldn't worry about it." And of course, when I went to America, I wasn't even there a year and I found a lump and went to Seattle, I can't remember, Seattle Hospital, and it was breast cancer hospital, and they were excellent.
Yeah.
And of course, with me not having any insurance, they found me a sponsor, which paid for it all.
That's awesome.
And yeah.
I mean,
I've never had medical treatment like it. It was absolutely fantastic.
Wow.
It really was.
That, even though you came to the United States on a whim, it was a blessing in disguise because, they found the cancer and you're still here, and that's an awesome thing. So I guess you got to look at
absolutely.
You got to look at the positives, I guess, out of any chronic disease that we get. And that's the positive that I would take out of that, Jan. So can you go into the mental health part of it again? Because I just know that dealing with any chronic disease, for me with multiple sclerosis, the hardest part about this disease has been the mental part of it. Just the dealing with society, the dealing with family members, there's just so many different things that are just tough about having a chronic disease with the mental part of it. Can you just go through how your family was, while you were going through all this, and did it affect your family? Because a lot of people don't even understand the amount of stress that it puts on just a family relationship and with society.
Mm-hmm. It has a huge impact. I mean, the fact that I, on this whim, just went to America. I'm now divorced because of it.
Oh, okay.
Yeah.
So it pretty much.
My mom and everybody didn't understand. Oh yeah, it completely changed and altered my life.
Yeah.
Because it didn't, I didn't just go to America on a whim. There was other things that I got involved with, and do you know what I mean? It's just stuff that I wouldn't even dream of.
Yeah,
it's crazy stuff. Yeah,
it's this is stuff that people just don't get. That we as a person that is diagnosed with a chronic disease and living with a chronic disease, they don't understand that a lot of these things that people say do are directly related to what their diagnosis is. And, and that's the part that's really frustrating to me, is that people don't take the time to give themselves some intelligence and learn about different diseases and how they affect lives. And that's the thing that I appreciate you wanting to come on here and talk about this, because like I said, I'd never heard of it. And that's why I wanted you on, because people need to hear this. This is something that I'm sure that people are dealing with today that are, they might have been diagnosed with fibro and they still know that something's not right, and they just got to advocate for themselves. And, they got to keep on pushing for that diagnosis. So how did they treat this tumor when they finally did, tell you in 2023 that, hey, we saw it in 17, but we're not going to do anything with it yet. And then now they acknowledge it in 23. How did they treat this?
The only treatment is to remove the adrenal gland.
Okay.
The consultant says, well, can you not just take away the cancer? Like they did with the breast cancer, just take the lump away.
Yeah.
He says, no, when you touch the adrenal gland, it just collapses. You can't, you've got to treat the whole thing. But they have to put you on alpha blockers first to lower the blood pressure, because when you go into surgery, if they touch the adrenal gland, then it secretes that much that it can give you a heart attack during surgery.
Wow.
They have to put you on the alpha blockers to make it safe, basically.
Okay.
And if you have a pheochromocytoma, or if it leaves the adrenal gland, it's called a paraganglioma.
Mm-hmm.
You must not at all have it biopsied.
Okay.
Because if they stick a needle in to biopsy it, it will make it secrete and it can kill you.
Oh my God.
So you have.
Yeah, this is just so crazy. I mean, I hope that people are, just listening and just, and I'm not saying that, go run to your doctor and tell them that, hey, I want to get checked for this pheo. But it's still, it's something to look at, and it's just a simple blood test.
Yeah. But sometimes the blood tests don't actually show, so they have to do a CT scan to see it. And they're usually found incidentally or autopsy.
Yeah.
That's how they usually find them.
Yeah, they usually find it after the fact, after you're already gone. Yeah. It's just crazy, Jan. I just, the way that you just keep on pushing on, I'm amazed by you. How strong of a lady you seem like you are. That you're always positive. Every time I talk to you, you're always positive. You're always joking around. And, I'm the same way. I use a lot of humor just to get through the day. And I think that's something, it's a tool that anybody with a chronic disease, can use, because what else can we do? I'm not going to sit and feel sorry for myself because I have MS, and I still want to live life, and I still want to live the life the best that I can.
Exactly. I use humour to help me get through the day because since they've removed it, I'm still having symptoms, but they can't tell if it's because I've got something that's still there because it's not showing up on the CT scan or the blood test, or if it's low adrenal function. Because obviously I've lost an adrenal gland because they both have very similar symptoms. And one of the major ones is it affects your mental health because when I came through the surgery, I wasn't well at all, and by January, but what you've got to remember as well, I had the surgery in September and I had a knee replacement in December the same year. And then in the January, I went into psychosis.
Oh, geez.
And usually that's an indication that you've got a low adrenal function.
Okay.
Because I was getting muscle spasms, but and that was quite scary.
Yeah.
And I'm afraid there was no humour during that period.
No.
But since I've come through that and understand it a bit more, I do use humour to get through the day. Because I'm having to actually go through EMDR, which is a light therapy to help me with the trauma of surgery.
Yeah. And this is, like I said, people just don't understand that, when somebody is diagnosed with a chronic disease, that means it's the rest of their life. And, we struggle, and, I think all we ask for is just for people to understand it. Just take the time to learn a little bit about what it's like to go through life with whatever disease you're diagnosed with. It's good for your mental health. I just think it's good for people to just educate themselves. And you're over in England, and we sit here and we talk all the time about, how you're perceived by society, how you're perceived by family members. And it's the same in England as it is over here in the United States. And, it's frustrating that people just don't take the time to learn about different diseases that affect people for life.
Yeah, people don't understand. I mean, even the medical profession doesn't understand, because if I, for some reason, end up in the emergency room, excuse me, they scratch their heads. They just don't know what it is.
Yeah.
Unless they can talk to someone who's higher up who understands about pheochromocytoma, and then it's like, oh, yes, that's what it is.
Yeah.
It's quite scary because, like I said, I'm still having symptoms and they're still not pushing. I'm having to fight with consultants who, yourself, they think they're little gods and you're not supposed to see anything, and you're not supposed to teach them their job.
Right. Right. Yeah. Right.
But it's so rare that they know less about it than what I do. I know more about this than they do because they have other things they're dealing with. They haven't got time to study up what this is.
Yeah, right. And a lot of times they're labeling it on something else, like the fibromyalgia, and they're just, okay, well, that's your fibro, or that's your POTS acting up, instead of looking for the actual reason why. I have my wife is going through the same thing. You know, she's been having symptoms for about 3 years, and they finally figured out that it's a parathyroid. And I'm like, what the hell is a parathyroid? You know, and it was a simple blood test to figure this out. And I'm like, why didn't they do this simple blood test 3 years ago? You know, it's just mind-boggling to me why doctors don't look for certain things. You know, you almost have to like beg them to do it, you know, and it's the same in England as it is in the United States a lot of times.
And as well, we've got a crisis with the NHS at the minute because they haven't got enough staff. And of course, since COVID, the doctors have gone on, they work differently now, whereas you could get an appointment within 2 weeks. Now it takes a month.
Yeah.
I know we've got a lot more people coming into England, but it shouldn't make that much of a difference to you know, getting an appointment.
No, it shouldn't. It shouldn't. It's you know, it's just this. Like I said, this is just another thing that people just don't understand that we deal with. And you know, I really appreciate you, Jan, for just taking the time to come on and explain this Pheo. I'm just going to call it Pheo because I can't. I'm going to butcher the name again. But you taught me so much about this, and I hope that everybody listening is, you know, just paying attention to it, and you know, just to make awareness that this exists and that people are suffering with it, and you know, it's just I really appreciate you just coming on and helping people understand. Mm-hmm. What would you say? Sure. You know, and I kind of want you to end with this, you know, put it in your own words. If you know of anybody that is like going through the same thing that you have gone through, what would your advice be to them that are searching for answers, you know, and like they're going through the same symptoms and they're getting blamed on fibromyalgia or POTS or something? What would your advice be to advocate for themselves, Jan?
Well, usually if someone comes to me and tells me they've got uncontrollable high blood pressure, that's the first biggest thing. Sometimes it can present itself as low blood pressure, but generally it's high blood pressure, and it's uncontrollable even with beta blockers. Mm-hmm. Because the problem is, if you have this and you have a high blood pressure because of it, beta blockers will make it worse. You have to have alpha blockers to reduce it. But, I mean, anybody who's got a faster pounding heartbeat, severe headaches, excessive sweating especially, shakes, internal or external tremors, and I know feeling anxious and panicked can fit a lot of things. Yeah. But if they go hand in hand with all the rest of them, you need to get a scan or a blood test. Yes. Mainly a scan, because the blood tests don't always show.
So when you say a blood test, is there like a specific, like if I went to my doctor and said, "Hey doc, can I request a blood test for this specifically?" What do you know what kind of blood test it would be?
Right. Well, I don't know if it's different in America, but here in England, the doctors can't order these blood tests. It has to be done by an endocrinologist. Okay. It's to check for adrenaline and noradrenaline, which leads to too many metanephrines in your blood. Okay. Which it can actually look like Cushing's disease, where you get the stretch marks and a big belly. Mm-hmm. Okay. Because actually, that's a tumor in. I can't remember if it's a pituitary gland or if it's something up there in your head. Mm-hmm. And then for no reason, it can just flip to Addison's, which is when you get too much adrenaline and you get adrenaline fatigue and you start losing weight. Yeah. But the rarer symptoms are you can have pale and flushed skin, you get an unexpected weight loss, severe constipation, high blood sugar, seizures, and blurred vision. Okay. So consequently, because of all this, it mimics a lot of other conditions. Like, hang on, I've got little notes here for it. I can't remember all these off the top of my head.
Yeah, but I mean, just from the symptoms that you just said, I mean, some of those are MS, you know, like the vision, and so it can mimic so many other things.
Mm-hmm. Well, I can totally relate to that, because at the minute, one of my symptoms is like the MS hug around my chest.
Wow.
And that could be the pheochromocytoma pushing up on the lungs. So it makes you feel like you've got this tight band around your chest. Yeah.
Wow. Mm-hmm. That's just so crazy, the similarities in symptoms. Yeah. It's amazing, Jan. And again, I really want to thank you so much for coming on and sharing this story, because it's something that people need to hear, just so that they can understand a little bit better. You taught me so much today, and I really appreciate you so much.
Well, thank you for listening to the story. Oh. All I can end on is, don't just take fibromyalgia as a diagnosis.
Yeah.
I'm not saying it's pheochromocytoma or paraganglioma, but it could just be something else that's easily treated.
Sure.
And then you can get on with life.
Yeah, absolutely. And like I said, for your case, it's a simple blood test. That's all they have to do is, just do this simple blood test just to rule it out. I don't want this. I don't want Pheo. But rule it out so that I can, we can figure it out another way. What's going on?
Mm-hmm.
Yeah,
exactly.
I love it, Jan. I thank you so much for coming on. You're the first person that I've talked to over in England that I'm actually going to be publishing. So I'm excited about that too. I'm
excited about that. I feel quite privileged.
I got a few people that I'm talking with over in England, but you're the first one. So I really appreciate you coming on and sharing your story with me. All right.
You're very welcome. And if anybody wants any more help with that or answers to anything, just let me know and I'll tell you, okay?
Yeah, absolutely. Right. If anybody has any questions for Jan about Pheo, you'll go ahead and leave them in the comments section. I'll get a hold of Jan. I'll somehow connect you with her if you want to talk to her. You can follow me on TikTok, MSMichiganMan64, and you can follow me on Instagram, MSMichiganMan64. And you can also find me on Facebook, Brian Wallace out of Brunswick, Ohio. And this is the MS Michigan Man 64. Brian, I am out until the next episode. You all have a good day.